And what they're saying is they're going to be doing an audit of the FEHB system and those that are dependent upon it. Now, it's not that federal employees and spouses and things like that need to be worried if they're doing it right, but they're going to be looking at, are people really married? Marriage certificates. Are people really a dependent? Because, as part of this, they just want to make sure that people are not taking advantage of the system. Now, if you're doing it right, there's nothing to worry about, with this. You actually would want, that to be the case where people are validating that the folks that are getting benefits from the system are actually eligible and should be getting benefits from the system. Why is that? Because if the system is giving out benefits to people who shouldn't be a part of it, it's costing you more money. Why? Because there's going to be more claims for those insurance companies that are offering FEHB plans. And in theory, again, doing an audit of the system to ensure that people are eligible for the program. Only the people that are eligible for the program are receiving benefits from the program would only benefit you. It'll help the insurance companies out, yes. It'll help the program out, yes. But ultimately, it should help your bottom line. At least that's my opinion of it based on what I know. Now, there could be other reasons, but you as a federal employee that's getting health benefits from a federal employee program, I would hope that you'd want your prices to be lower. Benefits to still be the same, but prices to be lower because they did an audit and found out people that weren't eligible for coverage anymore or weren't eligible for coverage at all are getting removed or disenrolled from the program. So this is one of those things that it's just going to be an audit of it. And if you're doing it right, great. But I'm sure, like me, if I had somebody that was dragging down, or let's say a whole group of people that shouldn't be on the program that were using benefits, if they got disenrolled because they shouldn't have been eligible in the first place, then that will ultimately reduce my healthcare costs. Again,